The cool sea breeze gently hugged Irene Karubo and cheered her to carry on, narrating her experience with Fistula, even as she put up bravado to keep the tears at bay that warm July Thursday afternoon. Karubo and I were seated at the seashore at the famous Mamangina waterfront in Mombasa. Perhaps this was the perfect spot for her to narrate her ordeal to a journalist, with the hope that her tale would inspire fellow women battling the war silently. I invite you to walk with us down this road. My name is Steve Mokaya. Try as she would, Karubo, 32, could at some point be overcome with emotions amidst the narration. Without a doubt, her 12 years experience with Fistula had weighed her down big time, and despite having repeated her anecdote several times to willing ears, she could at some time run short of courage to tell it all without pricking the goon. She recalled how cohabitation broke her virginity at 18 and made her pregnant and bitter.
In December 2009, I started developing symptoms that seemed to indicate that I was ill. I went to hospital, and upon testing, I was told that I was pregnant.
Her boyfriend denied responsibility and even blamed Karubo for the pregnancy. To assuage the problem, the two decided to terminate their pregnancy. This process exacerbated the situation.
I was filled with regret, knowing that I was coming from a background of great hardship, having been raised solely by my grandmother. I didn't know what to do, and so I decided to use all possible means to terminate the pregnancy. I tried using all sorts of medication, but nothing seemed to work. Instead, I developed complications like hemorrhage. This eventually caught my grandmother's attention. She affirmed that no one in the family had ever aborted, and hence I had no option but to carry the pregnancy to the end. Eventually, I gave birth in Kisumu. It is here that I believe I contracted the disease as a result of the manner in which the procedure was carried out.
I do believe in
Owing to her immature pelvis, she underwent some surgeries to remove the baby. She was cut in 3 areas, and that, she believes, opened the gates to Fistula. Soon after delivery, she returned to Mombasa and reunited with her boyfriend, the father of the child. Life will worsen day by day. The husband insulted and belittled Karubo due to her poor sex performance, which was as a result of Fistula.
Prior to the disease, I had been living peacefully with the father of my child, but he believed that I was sleeping around with other men when he was at work. Despite all the insults, we stayed together for a while until he eventually decided to leave.
But all this time, Karubo knew she had a problem, but couldn't tell the treatment, leave alone the exact cause. Signs were all over, things were not right, because even after they divorced, her female friends also gave her a wide berth.
My friends also began to desert me because of my condition. The disease makes it hard to live a normal social life. I could barely laugh or tell stories without wetting myself. I couldn't even go on long journeys without carrying a towel or rug. I resorted to staying home. I tried to Google and get information on the disease because I just couldn't understand what was happening to me.
One day in 2020, her son developed a skin disease and she took him to Bomb Hospital in Changamwe sub-county for treatment. It was during Corona pandemic period, and as fate could love it, it is here that her lips overcame the self-guilt and she poured her heart out to the doctor who was attending to the child.
During the screening of the COVID pandemic, I was able to find a male doctor whom I was able to confide in and was tested. The medics also informed me that there was free treatment. Now, I'm able to travel for long distances without the worry of unexpectedly emptying my bowels.
Upon successful surgery and repair, the mother of two decided to create awareness of fistula to get other women who could be suffering in silence to seek help. However, she believes that the government should help fistula survivors get back to normal life by giving them means of income.
There are people who have the disease but don't want to come out in the open. I therefore decided to open a YouTube channel to share with the world. I would go to churches and even crusades to sensitize people on the disease.
Currently, she makes liquid soap and sells it to schools and homes in Kaloleni, Kilifi County. She uses the earnings to support her younger siblings and her mother, who has epilepsy. About 120 kilometers north of Mombasa in Malindi town, Sarah Sidi, another fistula survivor, relates well with Kerubo's experience. Sidi got fistula in 2004 after giving birth at home to 3 kids, albeit at different times. To add salt to injury, all the kids died soon after they were born. Until to date, she's never known the cause of the death. Her husband abandoned her.
My name is Sarah Sidi from Bilore, Malindi. I was sick with fistula in 2004. When my husband saw me pissing myself, he said he cannot live with someone waiting for death. I was single till last year when I found someone else. Many of my friends abandoned me.
They say when it rains it pours, and so when Sidi's husband walked away, her mother, who was her sole caregiver and provider, died. Worse, she left her with 2 very young siblings who needed to be taken care of.
My mom stayed with me for a year. Then in 2005, my mom passed away, and I stayed like that with my urine. I despaired because my mom was looking for money so that I could go to hospital. And then she died and left me with 2 children.
Her friends abandoned her, but she was too resilient to see her siblings through school, and so she devised a plan to bake cake and give her siblings sell by the roadside in Malindi.
I just had to bake half cakes, but then other people started asking, who made these half cakes? I tried defending myself. It was I who made them. I who struggled until I made them. They said, probably she poured urine inside. Maybe she made them with period blood. You cannot even laugh because if you do, you'll pee yourself.
However, in 2020, Sidi's new husband organized her to get treatment in Mombasa's Bomb Hospital. She was later referred to Wadadia Safe House Camp Training Institution in Malindi. Wadadia stands for Women and Development Against Distress in Africa. It is a non-governmental organization in Kenya that offers psychosocial support, reproductive health, and economic empowerment to women. In the Malindi base, they train survivors of fistula in income-generating activities and offer them psychosocial support before reintegrating them back to the society. Currently, Sidi is being trained on cloth making and advocacy. She helps to create awareness of fistula in the community.
I thank Dadia organization. They have taken me far. Truth be told, I now know how to use a machine and how to cut cloth. You can see that now I have been able to cut this cloth without a teacher's supervision. I want to thank them for educating me. I will continue to influence people even when I leave here. I must make my opinion known in the streets. Now, I don't feel ashamed telling my truth.
Gloria Nyangena, a project manager to Wadadia in Kilifi County, said they first identify the women with fistula and then link them with their treatment partners for medication. After treatment, Wadadia absorbs them for a reintegration program.
We are working with women and young girls in terms of empowering them psychosocially, economically, and also in terms of their reproductive health issues. Right now, we are able to go into the community to do some community mobilization sessions and sensitization so that we can be able to inform the community about this fistula.
Nyangena said they have identified many women with the fistula, but only a handful are willing to get treatment.
We call them to a meeting and then we talk to them. Because of the shame, sometimes because they are not supported by their family members, and sometimes because of fear of the unknown, it's not easy for them to accept going to the hospital. It takes convincing power.
Besides the women's apathy to seeking medical care for fistula, Nyangena blames the government for lacking a policy to combat the disease.
There's a problem because there are no policies in terms of fistula. Even they don't have a specific document for that. The policies for fistula, it's not yet. They don't even have the numbers of people who have fistula in Kilifi County. Unless it is accepted and passed, then issues to do with fistula will be more.
Elsewhere in Naroko County, Nampayo Koriata, a mother of 5, chose fistula advocacy over good life and marriage. She had lived with the fistula for a decade without her knowledge. However, when she knew she was treated and started sensitizing women and the public about this disease, her husband could not contain the shame of being associated with a lady who had lived with fistula for a decade. He persuaded her to maintain a low profile and stop advocacy, but Nampayo could not hear any of it. The two parted ways. Nampayo now looks for women with the fistula and links them to Kenyatta National Hospital for treatment. She said the female circumcision and giving birth at home is the main cause of fistula among the Maasai women. To give pregnant women a shoulder to lean on for health security, Nampayo is planning to start a pregnant village in our community.
What I'm thinking now is having a pregnant...
What I'm thinking now is having a pregnant women's village where expectant mothers from the rural Maasai areas can come and stay until they give birth, instead of giving birth at their homes. The village will consist of residential homes for pregnant women. There will also be caregivers for them to help them through the pregnancy and reduce the cases of fistula in our community. It's sad that in our community, fistula is so common that women have gotten accustomed to it and they have sort of embraced it as a normal condition.
Nampayo is also convinced that having an exclusive institution for expectant mothers will be a big relief to the women in the vast pastoral community in Kenya's Rift Valley region.
We want to open the village and it will have a maternity wing to help these women. However, for now, we take the woman with fistula to Clinic 66 in Kenyatta National Hospital.
Itasaidia kupunguza kesi za fistula kwa sababu wamama wengi watajifungulia hospitali.
Nampayo said that female genital mutilation, otherwise known as FGM, is gaining momentum among older women in our community, thus promoting the increase in fistula cases in the same community.
There is also an emerging retrogressive tradition among the people in Wasinigishu County, which is fueling fistula. The new tradition requires that uncircumcised young men be blessed by their mothers before they face the knife. However, the tradition has a catch because uncircumcised mothers are not allowed to bless their sons. Consequently, several women are now going for circumcision to get the go-ahead to bless their sons.
Besides, she said that some women are sending their daughters across the borders to the neighboring countries to get cut.
Besides that, some mothers are taking their daughters to neighboring countries such as Uganda and Tanzania, where there are no strict laws against female genital mutilation. They cross over using the legal border points in Kajiado, West Pokot, Taita Taveta, Migori, and Narok. Sometimes these girls are married off across the border upon circumcision.
kuozwa huku, tena anaenda kutahiri na anaozwa akiwa mdogo.
She also contemplates starting a fistula marathon and hiking activities in Kenya and Tanzania to create awareness against the disease in East Africa.
Tunataka tuanze marathon
starting next year. We are also planning to have a regular marathon and hike in Mount Kenya and Kilimanjaro as a way of creating awareness for fistula in East Africa and supporting the affected women.
According to the World Health Organization, fistula affects approximately 50,000 to 100,000 women every year, and mainly these women come from poor countries in Africa and Asia. In Kenya, about 3,000 women and girls develop fistula every year, while the backlog of those living with unrelated fistula is estimated to be between 30,000 and 300,000 cases. Dr. Mary Maina is a gynecologist at Kiambu Level 5 Hospital. Dr. Maina said that an obstetric fistula is the most common type of fistula in women. It arises during childbirth.
The fistula basically means that there is a break in the tissue that separates the urinary system and the reproductive system, and that usually happens when a baby's head gets up. Someone is trying to leave a swim, so the baby's head gets up, and then it causes cut of blood supply to that area, which eventually just plows off and dies, and then creates that hole. The majority of fistulas are caused by obstructed labor.
Furthermore, Dr. Maina added that women who have undergone FGM, especially the type 2 and 3 of FGM, are more likely to get fistula. To be qualified to treat fistula, however, Dr. Maina said that one must be a trained fistula surgeon.
You must be a trained fistula surgeon to repair fistulas, yeah? So you find that most of the fistula repairs in our country happen in the 2 national referral hospitals, but now it's starting to trickle down to a few level 5s, eh? Yeah, so the fistula surgeons in the country have also been doing quite a number of camps, because not everyone can travel to Kenyatta or to Moi Teaching and Referral.
Moreover, Dr. Maina debunked the myth that fistula is brought by a curse and instead said that it is a normal health complication that can be treated.
Fistula is not a curse. Unfortunately, most of the communities where these women live believe that it's a curse. It is just a complication of delivery, like you would have bleeding of delivery, and there is help. This is something that is treatable and reversible. It could happen to anyone.
Unfortunately, a recent research done by the Kenyatta National Hospital, Kenya's largest referral hospital, revealed that fistula survivors are shunned by their community still, even when they get back from the hospital.
There's a study that was done in Kenyatta, so it was a follow-up on patients who had had a fistula repair. And one of the things they were finding difficult is reintegration. So now when they are released back after treatment, people still don't want to interact with you, you know. So they were finding it very hard to reintegrate.
To avoid or prevent fistula, Dr. Maina encourages women to do the following.
The main prevention for that really is to deliver in a hospital. We encourage women to stop delivering at home, to go for their clinic, because if you've been to the clinic, then you will understand. The health worker will have told you about the dangers of some of these things. And then, of course, we would want to encourage women to be screened for cancer of the cervix, because it's also another cause of the fistula, both the cancer and the treatment, because the treatment, which is radiotherapy, sometimes can actually cause fistula. And then, of course, we stop the gender-based violence where women are raped and they are harmed and injured and end up with a fistula.
However, as much as most fistula cases can be treated and reversed, there is an exception.
Yeah, the ones caused by cancer sometimes can be difficult because the tissue around there is not normal. For cancers, sometimes that may be impossible to repair, but then there are other ways of diverting. Those are extensive surgeries that end up diverting the urine into the intestines, be treated, what we call urinary diversion. So you divert the urine from the bladder into the intestine, so it will be coming out together with stool.
Dr. Mana said women who have undergone fistula repair should only deliver through a cesarean section because once you have had fistula, the probability of it recurring during vaginal delivery is quite high. Many thanks for listening to this documentary. My name remains Steve Mokaya, and until next time, bye-bye.